Be started. So welcome everybody. My name is Grant Martin. I am the network coordinator for the Canadian Shelter Transformation Network. Happy to have all of you join us here today. And let me just pull up and share my screen and we'll get things started. And then, Chris, do you just mind confirming with me that you can see the full screen in presentation mode? Great. Okay. So welcome everybody. This month's topic is all about data. So why data matters, the power of data in elevating emergency shelter performance. First, I want to just start by acknowledging that the land that I am situated on is the traditional lands of the Haudenosaunee, the Anishinaabeg, the Lenape, and the Attawandaron peoples. I honor and respect the history, languages, and culture of the diverse Indigenous people who call this territory home, and I'm grateful to have the opportunity to live, work, and play on this land. But also I recognize that CSTN is part of a national network, so from coast to coast to coast, we acknowledge the ancestral territory of all Inuit, Métis, and First Nations people that call this land home. I subscribe to land acknowledgements by personally stating what I can do as a treaty person. I encourage others to seek learning and discourse about Indigenous communities. And those who learn, please share, and please ensure we are sharing truth. I aim to incorporate Indigenous ways of knowing into my professional practice when appropriate and approach it with cultural humility. A few housekeeping items for today. One is please mute your computers just so we can minimize the background noise and things like that while people are presenting. The other is you can ask questions at any time. I just ask that you use the Q&A box. Don't use the chat for questions, just so that we can use the Q&A just to monitor one section. There will be time at the end of the presentations that are specifically to review questions from that box, but also people can raise their hand to participate in Q&A at the end. And then the webinar and slides will be posted on the CSTN website shortly after the session. So within typically the first week following the session completion. And you can find that at transformshelter.ca. I also post it in our CSTN Facebook group. If you're not part of that group, please feel free to join. I also share other resources there. And then our session will be 90 minutes. So that's a max. I've been failing pretty consistently at holding us to that 90 minutes, but I'm just assuming that's because of poor facilitation skills, or maybe it's also just because of really great engagement from the speakers and the attendees. So we host these webinars as part of a monthly series for a few different reasons. One is that we are committed to this idea of really strengthening shelter services to improve housing outcomes for people experiencing homelessness across the entire country. But we also really want emergency shelters to feel like as if they're not these standalone entities in their communities. So how we can help with maybe greater alignment for emergency shelters with the goals of the broader community in which they find themselves in. And then really trying to encourage and find ways that shelters can move towards being more housing focused and lower barrier for their guests. And the other is taking away the guesswork for our emergency shelter guests, right? So being able to help emergency shelters establish clear service expectations for all their guests, wherever they may seek shelter, whether that's in places like Winnipeg, Manitoba, or where I just came from last week, Cape Breton in the lovely province of Nova Scotia. The outline for today, we have our presentation on why data matters. That's going to be coming heavily from our two guest panelists, Chris Gorman and Paul Lewin, who I'm really quite honored to have join us today. And then we will have the questions from attendees towards the end. But there's also going to be a piece where I'm going to ask folks if you can get your phones out and your cameras ready to scan a QR code, at least so that you can bring up the link to complete maybe a short survey after today's presentation. We want to hear from CSTN members around our agenda for 2025. We have some ideas of topics, but we want to hear how important those topics are to you. And if there's any topics that are not on the agenda for this coming year that you think are important, please share your ideas with us. So be prepared to get your cameras out from your cell phones to scan the QR code and follow the link. So our mission here at CSTN, we really are seeing ourselves as a network of homeless shelter leaders and organizations committed to housing-focused practices in emergency shelters because we see shelters playing a vital role as engines for ending homelessness in Canada. So we want to be able to really commit to that change. And with that means true peer-to-peer knowledge exchange so we can learn and grow together to achieve that mission together. Some of our activities, a lot is around resource development and capacity building. So how can we help you grow that capacity to be lower barrier and more housing focused in all kinds of different ways in the day-to-day operations of your shelter? So we do that by collecting and sharing shelter-based resources on our websites, but you can also reach out to me directly and ask for specific resources for things that you're facing in your shelter, and I can help broker relationships to other shelters who might have already started to do some of that change work. Um, we have the monthly webinars, but we're also, Chris is actually a part of this with me, is developing, in the process of developing a national guidelines and certification process to kind of create some consistency in what we mean by a housing focused shelter. So that's to come, but we're in the process of developing that now. And then obviously we can help with things like being a voice of advocacy around shelter issues and housing rights and ending homelessness in Canada. So if you're looking for support, this is how we can assist through the webinars, through things like self-assessment tools that have been developed and are hosted on the site, and by sharing tools and opportunities for peer learning wherever it can happen outside of the webinars as well. This is where you can find those tools that I mentioned. If you go to the transformshelter.ca website, you can see that there's a resources tab that has dozens upon dozens of tools and various resources shared by emergency shelter operators from across Canada, the United States. So don't ever feel like if you're trying to create a new policy or deal with how to accommodate pets or something like that, you have to create it from scratch. There are examples of a bunch of different things that are already hosted on the website that you can reference. And the other is that all the webinars that are created or that we host are archived and are available for viewing under the webinars tab on the website. This is a bit of our series for the year to come. So you'll see next month, I'll just do a quick pitch, is about motivational interviewing and assertive engagement, specifically in a shelter setting. So how we as shelter operators roll with the resistance to the rehousing process with some of our shelter guests, and especially some of our potentially like longer term stayers. Okay, so you won't hear from me very soon because I really want to maximize the time that I'm giving to our really wonderful and really smart and talented presenters today. So I want to introduce two people who I've gotten to know pretty well over the past year in my current role. First up is Chris Gorman, who is a senior associate with OrgCode Consulting. Chris brings a wealth of experience. You may have also known him previously from his work that he's done in New Brunswick. And then also joining us today is Paul Lewin, the Manager of Advocacy and Accountability from Silo Mission in Winnipeg, Manitoba. I think Paul has one of the coolest job titles I've ever heard. I've never heard someone with that job title before. So I'm going to pass it now over to Chris, and I'm going to stop sharing my screen so he can start sharing his screen.
Thanks, Grant. So I'm gonna attempt to share my screen and hope this part goes smoothly. Good?
You're good.
Perfect. So I also just want to say as I get started that when I'm at home, which is rarer and rarer these days, I do get to carry out my work on the traditional and unceded territory of the Wolastoqey, Mi'kmaq, and Peshkmatati peoples. So I'm based in New Brunswick, and I take great pride in that. And in fact, love to rub it in people's faces every time I'm not in New Brunswick. So uh, this topic, I promise I won't promise Paul I won't take the whole time, but I really want to because I love this topic more than I probably legally should. So data in shelters. What I want to start with is like it's not shocking, but most people don't get into shelter work because they love data, uh, especially because they love data entry. Most people that I come across do this work and got into shelter work because they care deeply about people who are overlooked by most of society, and they tend to stay in this work because they can see the impact they're making. So, what I want to focus on is three main areas that are really important when we think about data in shelter. So, to do that, I think the overall theme is like is why. So when we talk about the importance of data in shelter or the overall system, we need to draw far more concrete lines as to why that data is important. And the best way to do that is to ask a few simple questions. So who benefits from it? How are they better off because of it? So as you can see from those three topics, I'm not even going to pronounce the first one. I keep writing it and wanting it to be a word, but I can't force it out of my face. So data advocacy. Uh, uh, but essentially, we fail a lot of the times because we fail to make a few key connections. So we collect data, but we don't use it to drive change. That's that first topic. We may tend to focus on the wrong data. So that's the second. And then we often treat data as separate from the real work that we're doing. So how do we not see data as a burden in our work or a separate piece of our work? So if you can, and Grant, maybe you can monitor this for me because I'd see now that I can't see the chat. But if you can put in the chat, if you work in any capacity in a shelter and the data, so any variation of a yes will do. But is the data that you're asked most about consistently about like heads and beds? Like how full are you? Are there any yeses, or like are people so much more advanced now?
There's an overwhelming number of yeses. There's one no, which that's kind of cool to hear.
Yeah.
There's an of course with an exclamation point.
Yeah. I mean that it would be really great info if there was never any new inflow into homelessness. Like if our population was static and occupancy rates really dictated uh a true measurement of system level data, that would be a great data point to focus on, but that's not the reality. So what we need to do, I think, is start to think of data as a giant puzzle. So each piece represents part of a guest journey, their housing exploration, what they need next to see a positive exit from shelter. And when you input data, you're placing a vital piece of that puzzle and adding clarity to their story, which is guaranteed to be unique from everybody else's. So when data is missing, we see gaps form, and that affects so much for a client's journey. So existing barriers to housing, to how shelters operate, or even our broader understanding of homelessness gets misconstrued when any relevant pieces of data are missing. So we may be overlooking trends like most shelters are seeing that are doing good data collection of like higher rates of seniors experiencing homelessness for the first time. So also when we're not inputting data, even though it feels time consuming and an aside sometimes. What's also happening is decision makers of all levels don't get access to the full picture. Uh, so they may end up funding the wrong things or misdirect resources or make policy decisions that don't align with reality. Uh, so I've always tried to say in my previous role as director of data and impact for New Brunswick that consistent data entry is one of your strongest forms of advocating for those clients that you care deeply about. But it's also a really important way to educate decision makers at all levels to better understand the realities of homelessness these days. So data should be used to drive better decision making. And it should be at least across these three main bucket areas. So guest outcomes, internal and even community-wide policy and process improvements, and then resource allocation. Uh, Luckily, Paul is going to touch on the work that he's doing that really is impressive and hits on all three of these. But I do want to show a few quick examples of folks that I know of across the country that are doing some really impressive work here. Just to highlight some areas where this is being done. So the first, this slide comes directly from our friends at the Drop-In Center in Calgary. So this is data, really, really timely data. So this is the full scope of 2024 data on their amnesty totes. So for folks that don't know amnesty totes, I'm sure you do, but those are essentially just secure storage bins that shelters can use to temporarily check in things that would be prohibited items at most shelters. So guests can put their belongings when needed into those totes, and that helps balance, safety and harm reduction. But what we can see in this slide, and I think this is just unbelievably powerful, is that yes, the program was used a ton of times, so about 20,000 times over the course of last year, amnesty totes were used. So about 2,500 plus unique individuals. But it's that piece over on the right. So one individual used that program 276 times out of 306 nights. So that is impressive alone. It's good tracking of the work that's being done and the efficacy of, or at least the uptake on programs. But when you really dive into that with the staff at the drop-in center, what they noticed at the same time was a correlation. So they saw a 20% reduction in their category 3 and 4 service restrictions. And so if we know people are then able to get into shelter more and are restricted less from accessing shelter and services, then they can be supported differently. And so they saw uh, more positive exits from shelter. And so like this is really interesting data in that it's showing program usage, but you can draw lines to overall shelter outcomes and guest outcomes. So not surprising, but great job from our friends at the Drop-In Center. The next is a dashboard that is hosted now on the Government of New Brunswick website. And this pulls HIFIS data from all existing shelters across the province as real time as can really be done. And leadership decision makers in the province look at this on a daily basis. I can attest to it because I used to have to update it on a daily basis to really drive their decision making. So everything from like they use it to assess trends, of course, but when they're looking at do we need to add capacity, like is a storm coming? Like, what are we doing about shelter capacity? They're able to look at as real-time data as possible and make unbelievably informed decisions based on data as opposed to guesswork, which is where we've been at for so long. So, those are a few examples of folks using data well in decision making and advocacy. Paul will touch on this far more in his presentation and his work. Uh, but what I want to also say is we spend a lot of time focusing on the wrong data, and that just tends to overburden staff and make data really feel like an administrative nightmare. So I know we all know how to count. Let's, as a sector, move away from focusing on just the counting and how much did we do data. So if we can start to think of things far more about what effect do we have versus how we're measuring effort, then we can, I think, move away from the idea that data gets in the way of the real work. So when we focus too much on the counting or how much did we do, like things like how many meals served, how many showers taken, how many people received mail, all these numbers do, and while they may be important still for some funders, I think there's work that can be done there. Uh, they just prove that we're busy. So if we can, when we're framing data as just tracking activity or counting what we do, we reinforce the idea that data is really about documentation and not about driving change. So the real goal should be down at the bottom. Is anybody better off because of the services we're providing? So data should really help improve outcomes, advocate for those resources, but accurately be able to tell a story that people are better off because of the work that we're doing, as opposed to we are very, very busy. Well, we know shelter work has never been busier or harder uh, anywhere across the country, so we already know that. So I assume, and you've probably even touched on this at some point already in a webinar, Grant, but folks likely know the term legacy rules in shelter. So legacy rules are rules that are being implemented despite uh, not knowing why they exist or who they benefit or how they make things safer. They just exist because they always have. So I think there's also legacy data in shelter these days, and that would be data collection that takes up really valuable staff time, even though nobody can really attest to why it's being tracked, who it benefits, and how it contributes either to improving a guest's housing journey or enhancing the shelter or the overall community or even the understanding of homelessness. So uh, data that we're just tracking because we've always tracked it. So I'd be really interested if we could try in the chat again, if anybody, like, are there legacy data pieces that you're still tracking at your shelter? Somebody may have an understanding of why, but if you don't, then that's probably problematic. But if you could put it in the chat, are there any legacy data pieces that you're still tracking?
So just to be clear too, Chris, like legacy data is like, uh, you know, we're tra data I'm tracking that I don't know why the heck I'm tracking it.
Yeah, yeah.
Okay.
We've always tracked it, somebody says it's important, but nobody can say why.
Mm. Well, so far it looks like this group doesn't have to do any legacy data tracking. What a lucky group.
Or or people are going, well, I think that's most of what we're trying. Uh, so if like keep throwing them in the chat because I really would be interested in that data moving forward. If we're gonna make some broad scale improvements in our sector, it's good to know what people feel might be taking up their time that doesn't have a whole lot of value. Uh, so the other piece in there when we think about that is that shelters cannot do this alone. So especially when we think of shelters that are using HIFIS across the country. So to ensure the success of data tracking and reporting, it's really essential that shelters have strong, trusting relationships with the other people responsible for data in their community. So whether it's coordinated access leads, HIFIS leads, systems planners, funders, whoever it is, there has to be trust in there so that when people are asked to track certain things, they know it goes somewhere and is used to benefit the people they care about. So, two-way, honest communication is vital there. So, shelters, they need to know not just what's being asked of them, but why specific data points matter and how they will be used to drive improvement. So, like, housing history has been such an important piece that has been asked of folks entering data in the HIFIS for a long time now, but very few people have been told why that matters. And in the end, these days, it's really vital because it's our best way in HIFIS to track chronicity. And most communities prioritize those who are experiencing chronic homelessness over those who aren't. And so if we're not doing that housing history piece, people may not be being prioritized. But if we're not communicating that well, and we're just saying you have to do housing histories, we're missing the mark on why people do this work and how to get people focused on data. So again, like stay away from like top-down directives. So if there's anybody on this webinar today that is a HIFIS lead or any of that side, like whatever we can do to have two-way communication that allows shelters to like share their challenges as well and not just give directives on what needs to be tracked, but really work together, you'll see far better outcomes. And again, tie it all back to the broader impact. So shelters absolutely need clarity on how their data fits into the bigger picture, and staff need to see how their data feeds into those system-wide trends and reports and decision making. Uh, Otherwise, we're just asking people to do an incredible amount of work on top of an incredible amount of work already, and we're not showing them how that impacts the people that they care for. So uh, a few tips I think on best approaches to help ensure how data can be embedded into your shelter. Uh, so one, I would say for all leaders who are part of this or who may watch this later, you have to lead by example. So if you never log into HIFIS, if you don't engage with your data, how can you ask your frontline staff to do that? Because leaders lead. So you should, as best you can, review your data regularly, use it to drive internal decision making, and reference it as best you can in staff meetings to highlight what's working and what's not. So it shouldn't be about micromanaging data entry or monitoring, who's using HIFIS. It's really showing that data matters beyond compliance. So your role as a leader in this side of the work is to model data as a priority and not an obligation for your frontline staff. So again, thinking about those legacy data points, we can do, I think, a better job at streamlining data input. So look at so identifying cut out legacy data pieces if you do have them. Not all data points are equally important. Focus, identify and focus on the ones that are, build that value, and then expand over time if need be. Uh, and provide ongoing training. So like one of the things I see consistently going into shelters is staff wanting to do a better job, but not necessarily having the time or the training to use some of these data systems. HIFIS is not that complicated, but it's a whole lot more complicated than not using HIFIS. So most of the folks that do HIFIS training are HIFIS professionals. They expect or often operate in a way that other people can operate the same way. It's not true. So understand that people do need training consistently. We have a lot of turnover in this sector, so keep providing training at every friggin' opportunity. If you can build data entry into staff schedules, it's a huge asset because what we don't want to do is start thinking of it as taking time away from work, but rather embedded as part of a core part of the way that we do our work. And then this is dumb that this is going to be the legacy that I leave behind in this work, and I'm embarrassed by it. But for years in New Brunswick, when I was focused on data work, it my job I felt like was sales. So like, how do I get people to do this in a way that doesn't distract from the work, but they value it in the same way that I did? And what I did was this is dumb. I'm sorry, Grant. But I created trophies, and they were called HIFIS Champion of the World, and they're like $9. But I made them as big as you could possibly get a trophy made, and presented them out to folks who were doing really great data work in very public settings. So like we had an annual summit. And so I was able to present this is Sue. She works at a shelter. She's phenomenal. And she was our inaugural HIFIS champion of the world winner. But she got that award in front of like 300 of her colleagues. And that built some goodwill towards HIFIS and our data-driven culture in the work, and it was fun. And then it just created competition. So people really wanted that trophy. And so we did it every year. A few years, I had to step up my game. So we also created hoodies that on the back said, "We make data look good." People love those hoodies. So lots of like creative ways to sort of value your data champions, but nothing will matter more to folks doing this work than finding ways to ensure that the data that you have and that you're tracking and you're asking folks to track is being used. So as leaders, managers, staff, be super curious about the data, like dive into it, look at things, assess trends. Don't just think of it as data entry, but as like access to info that makes your job uh, better. So little things like, you know, let's say average length of stay. So assess what your average length of stay is in your shelter currently. Set a stretch goal of reducing that by 10%, and like try to hit that this quarter. You can't do that without data. You can't measure your successfulness of it. Uh, but those are the types of usage of data that people can really get behind because it's it's helping the people directly, the guests that we care about. It's improving our operations, and it allows us to sort of highlight outcomes and results at our shelter and not just occupancy level data. So I think for me, the more staff and guests, and I think even community members see how data is being used, the more likely they value their part in it. And so uh, if we can just start getting away from the idea of like shelters are really great places to input data towards shelters are the best possible places in this sector to use data, then I think we can all be a little bit more effective in our work. So that's it. The QR code there for people that are interested is you've probably seen the emails already, but is for an upcoming leadership institute that we're hosting alongside CAEH in April. So if anybody's interested, check that out. And with that, I'm going to hand it over to the much smarter Paul, or probably Grant, smarter Grant, and then smarter Paul.
Thanks, Chris. And before we pass it over to Paul, I just want to highlight some of the conversation in the chat. There is kind of this vibe or this feel from folks is saying that, yeah, like oftentimes data entry feels more like there's that data entry instead of a two-way street to say, I entered it. Now, how did that information help you with making decisions and change? It feels more like something as like an obligation to meet funding requirements instead of tracking outcomes. And the other thing that I'll highlight too is like a good example of this are like AGM reports.
Hmm.
I think organizations are slowly moving away from this, moving more towards reporting on outcomes. But AGM reports are filled with, stats around how busy you were this past year, as opposed to like how effective you were. How did we move from how busy we were to what was our impact in changing someone's life in a positive way?
Yeah.
Um, so I want to thank folks for contributing to the chat. And I will say too, like, um, as someone who's been a decision maker to figure out where we need to invest our time and energy and things like that, the data entry piece was really, really critical to inform my decisions with my peers at the decision making level so that I felt like we were putting our energy in the right areas. And then the responsibility of reporting back to say, hey, based on this tremendous insights that your data has provided, here's what we did and here was the result. So I like that you hit on that piece around the importance of the two-way street and that relationship. So with
Yeah.
that,
I would,
oh, sorry.
I would just say, like, I think that for anybody that's ever walked into any shelter, Uh, the one thing we do not need to prove these days is that shelter staff are busy and that this work is hard. Like we know that. We've proved it time and time again. So we can move on from proving that with our data.
Hmm. All right. So with that, I'll segue over to our friend Paul, who really is going to talk about Siloam Mission's journey with data, and then be able to share with us kind of how data helped with informing decisions and setting priorities within their shelter. So take it away, Paul.
Yeah, thanks, Chris, and thanks, Grant. My name is Paul Owen. I work at Silo Mission in Winnipeg. We are a shelter, drop-in health center, and a housing-focused shelter in the last couple of years, with 143 beds and about 180 staff in total over all the services and programs. I've been working at Siloam for 6 years now, and my role now is manager of advocacy and accountability. And the accountability piece of that title is the data piece, and that's what we're talking about today. So what I really want to start off by talking about just an overview so that you kind of know where we're going. 6 different pieces to this presentation. First, why we started on this journey, then the spreadsheet, and I'll say why it's in quotes when we get there. Shelter data 101, shelter data 102, and operationalizing the data, and then what's next. Um, So we'll jump right into why we started on this journey. The biggest piece was that we couldn't report on Ian's metrics. We looked at his 3 metrics of length of shelter stays decreasing, positive exits to housing increasing, and returns to shelter decreasing. And based on how we were using data, which was tracking just in HIFIS, we didn't really have a good way to understand this and what the experience was like for pretty much any specific group or person in the shelter without going really in depth into looking in their HIFIS profile. And so that was a problem. And we knew we wanted to do something about that. We also noticed that there was a mismatch between staff perspective and shelter users. And that is by default, the staff will remember the shelter users who are there the longest. They're the ones they have a relationship with, they talk with, they see all the time. So they will remember. And because of that, they'll project onto all shelter users that memory. And so they'll assume that all shelter users are the same as those shelter users, those who are there basically perpetually. We also noticed that all shelter data, including data conversations back in Ottawa in November, were about tracking and reporting. And obviously we saw that in the chat here already, and maybe kind of on a monthly or annual basis. And there was nothing about operationalizing the data and acting on it more or less immediately. And so that's been a really big focus for me because most of our staff don't like entering data, generally speaking, and maybe it's different in your organizations, but I can say for Siloam for sure that the people who get hired and want to work in social services like this don't generally want to sit in front of the computer for an hour. And part of that is because they don't see the benefit. They don't know where that data is going and if it's being used for anything. A lot of the times, even when we submit our reports to funders, we're not even sure if they get looked at. That's not always obvious to us because they certainly don't respond. And that's also because there is no, or sorry, the staff are often discouraged because there is no feedback loop. They're not seeing what's happening with that. Because of the staff just don't do it or they do it poorly. So we wanted also to use data to be person-centered and trauma-informed so that staff can know what needs to be known at the right time without the person having to tell their story over and over. So we can take action when it's necessary and make sure that no one slips through the cracks. So the spreadsheet is exactly that. It's just a giant spreadsheet that has been collecting over 22 months. We have been tracking those who use the shelter and just basic demographic type of information. But every new time we enter those who use the shelter, we just have another new column. And that goes all the way back to March 31st of 2023. And I did it in 6-day snapshots. The thinking behind that was that every 6 days, I basically took a look at who was in the shelter and I entered them into the spreadsheet. I wanted to do weekly, but I didn't want to always have the same day of the week. So I didn't want to know if Wednesday was always the same day or whatever it was. I didn't want to know who was here on Wednesday. I want to know who was here overall. And sometimes there might be different patterns of usage over the weekends or weekdays or different things. So 6 days allow us to get roughly what we call weekly snapshots, but they're always changing which day of the week it is on a rotational basis. We could do it every day. It takes me about 45 minutes to update the spreadsheet every week. It could be done every day. Time was the main constraint there. And that would improve the accuracy of the data for sure. But it would, 5 times more time entering the data would probably not prove the effectiveness 5 times. It might improve it 20%. So this was the decision that we made time-wise. We've used the spreadsheet to inform housing strategy decisions. We've used it to confirm some of our observations, so our anecdotal observations. And then we've also used it to break some myths, and I'll get into those a little bit. And then we've used it to drive housing-focused conversations. And the reason the spreadsheet was in quotes on the first slide and now is all kinds of goofy letters is because it's kind of become this anomaly at Siloam. Like people talk about the spreadsheet, even people who don't use the spreadsheet know that the spreadsheet exists and that it matters. And so it's kind of become this joke, like when I open it up, everyone freaks out because it's gigantic. And then when we walk through how it works at the end, they're like, I appreciate that we have this. So Shelter Data 101, this was based on a report I created almost a year ago that I called 1 Year in Shelter. And it looked at that first year of shelter usage. And I asked 6 questions. Who is using Siloam Shelter? How long are people staying? Do people come back? Who is staying long? who is leaving the housing, and is anyone helping them find housing? How long were they unhoused, and did they return? I know that's 3 questions in the last one, but we'll pretend it's one. So we're going to look at each of those questions, and this is obviously just for Siloam, and your shelter will obviously vary. So this is a chart of the gender mix and the age mix in the shelter. So on the x-axis, we have 0 through 30, and that's a percentage of total shelter users. And then on the y-axis is age. So it's grouped under 20 and then in decades from then on. And it could be 70 plus because we do actually have a few 80-year-olds now. And so the red line is the percentage of the shelter that is that age. So 20 to 29s make up roughly 14 point something percent of the shelter. 30 to 39s make up 27%, and so on and so forth. But within each age group, we can see who's overrepresented in a gender mix and who's underrepresented. So at the young ages, women are overrepresented, and at the older ages, the males are overrepresented. And that thread will come back a few times. The second question is, how long are people staying? This is my favorite one because I've been able to use this chart to break a lot of myths or bust a lot of myths and break some stereotypes. So along the x-axis, the bottom, is how many snapshots have those people stayed for. So on the left, it's 1, which is roughly 6 days on average. And then on the far right is 102. And at the time of preparation of this, that was the max. It's beyond that now in the actual spreadsheet. So 420, 430 people have stayed for one snapshot. Now that actually makes up about 1/3 of the entire collection. And I call this category quick. So essentially 1/3 of those who are using our shelter stay for a week or less. Then we have what I call the short category, and that's 1 week to 1 month. And that's from 2 snapshots to 5 snapshots. And that's roughly another third of the shelter users. Then we have what I call the medium category, and that's from 6 snapshots to 30, or 1 month to 6 months. And that is roughly another third of those who use the shelter. Now, obviously, if you know math and you add 1/3 plus 1/3 plus 1/3, you get to 1. So if we just shrink all of those thirds down a little, there's a remaining 8% of shelter users that use the shelter for longer than 6 months. And I call this category chronic. So you've got quick, short, medium, and chronic. This group of chronic, this 8%, often would be considered the default user. And the problem is that when we walk into the shelter on any given night and we look at who's in the beds, about 50% of the people in the beds are chronic. And so we tend to mentally think that 50% of those who use the shelter are chronic. And that's absolutely couldn't be further from the truth, because they are massively overrepresented on any given night. When you look over the entire year, they only make up 8%. So where they're locked onto a bed for 8, 10, 12, 16, 18, 24 months, someone else is coming for a week or two, or even less than a week, and that bed is rotating 50 some odd people through it over the entire year. But our brain only remembers that default user, and we need to really get out of that mindset so that we don't just see the world through that lens. Do people come back? I was almost going to say this is my favorite chart. I just said that on the previous one. I can't say that for every chart. On the bottom here, we have how many months we're looking at. So that 0 month means the first month someone comes to the shelter. And so you can see on the y-axis that between 200 and 250 unique individuals access our shelter in a month. This is largely limited by size. If we had more beds, the number would be higher. But 1 month later, that is down to 160 people. What that means is, of those 230, let's say, 140, 130 of them are there the next month. Then the month after, the number 2 month, that's down to 110. So we're actually now at half. Half of the shelter in 2 months has basically already turned over, and that continues to decline. And so what we see is that after 8 months, around 75% of the shelter users have turned over. And we've got that consistent base that you can see that tails off. We're going to talk about that base a little later. But this decline in shelter use and this decline in returns to shelter is incredibly predictable. I update this number every month, and I literally look at what the starting number was. It's around 235, and I'm like, oh, it's going to be exactly 167 people. And like, I check the number, and it's 168. And I'm like, oh, I missed it by 1. It's an incredibly predictable decline in people resolving their own homelessness and not coming back to the shelter. Now, the who is staying question, in terms of who is staying long, is represented here. So I've got two charts, one showing age, one showing gender. Overall mix, you can see 18 to 29s are the blue, orange is 30 to 39 and whatnot. There's a relatively even mix in the decades, with obviously the 70 plus being the smallest one. But then you look at those who are in the quick category, that's the 1 week or less, and that shifts, it skews younger, right? And so does the short. But then we get to medium and it starts to go the other direction, it starts to skew older, and then chronic starts to really skew older, where we have very few folks, less than probably a third of those who are young, are become chronic. And we see that expand at the 60 plus and 50 plus category. And similarly with gender, we see the overall mix, then we see the quick mix, the short mix, the medium mix, and the chronic mix. And we see here as well that the chronic mix has skewed male, and the quick mixes are skewed female. And so basically to answer the question, who is staying long, it tends to be older males. We see this over and over and over. So when we go back to that diversion chart, this one that shows who's coming back, that long tail is predominantly older males in our shelter. Obviously, your shelter may be different. So that's who is staying. Who is leaving the housing? Here in the last 20 months, 150 people have been directly housed from the shelter. We've housed as an agency 210 in total, with 23 of those being resolved or housed by other agencies and 13 self-resolved. And so you can see the numbers there and then how long they were in shelter and how many of them have returned. So when someone leaves the shelter to housing in our spreadsheet, essentially I keep track of what day they got housed, and then I change their row in the spreadsheet to yellow. And then if they ever come back and I'm going through entering names again and I get to their name and it's yellow, I know this person has been housed, and I follow up with their caseworker. I send an email to the caseworker immediately saying, this person's back in shelter. Can you go check in on them and see what happened? And 95% of the time, the caseworker emails me back and say, we're already on it. We saw them. We're doing it, which is fantastic. They didn't even need me as a reminder to do that, but they knew already. And then when they get housed again, I have now a second column that's starting of their second housing, and one of the people I think is on their third already. And so just recognizing that obviously people will come back, but trying to reduce that number to as few as possible. So that's the Shelter Data 101, and that's the spreadsheet, or sorry, the report I built last year based on the spreadsheet. And this year, I wanted to go much, much further, because in the ensuing year, I kind of developed the technique with the spreadsheet that I was excited about trying. And so I wanted to look at what I'm now calling Shelter Data 102. And this comes from what I'm calling our 2 years in shelter report, except that I prepared it for this presentation. So it's 20 months of data, not 2 years. And I wanted to look at correlating data. In other words, looking at important metrics through the lens of other demographics or metrics. Basically asking the question, it's easy to know the overall average of who's using our shelter, but are there groups that have fundamentally different experiences? Is it just for them it's different? So the metrics that I look at are on the left side here, the days before arriving. What I mean by that is if they're entered into HIFIS by a different shelter that's not us, how many days was it from when they arrived in that shelter to when they came to us? And obviously there's a whole bunch that came to Siloam first as well. Then there's the length of stay. That's from first day to last day. Then there's gender identity, indigeneity. I look at HIFIS number. I look at newcomer status, age at first stay, whether they got housed or not, whether they used the shelter in a variable way, meaning they come back and go back and leave and come back and leave again. The average stay length, so one stay being from when they arrive to when they leave, that's one stay, and then they go away and then they come back, that's a second stay. How long are those? The total number of stays, and so who's here intermittently the most, and then snapshots. And I'm looking at those metrics through the other lenses of gender identity, indigeneity, newcomer status, arrival at Siloam, age, departure from Siloam, housing status, and number of stays. This will make a little more sense when I go to the next slide. And that is here, for instance, is a look at who in our shelter is Indigenous. And so we can see here that in the average row, can you see my mouse, by the way, if I wave it around? Yeah, okay. So if we look in the average row, we see that 43% of those who use our shelter are Indigenous. And anybody above that, any group above that, means it's an overrepresentation of Indigenous people in that demographic, and any group under is an underrepresentation. Obviously, some of these are just small, minor deviations, so it's probably not that significant. But for instance, we see here that for those who stay and go and stay and go and have come 11 times, 78% of that group, sorry, it's 11 or more, there should be a plus there, 78% of that group is Indigenous. So that variability of shelter use is very tied to that correlating factor. We also see that 66% of those females who use our shelter are Indigenous. And that's really important when we contrast that with the fact that down here, only 36% of the males who use our shelter are Indigenous. So that's an almost 2 times difference. And so we can look at a bunch of different things through these correlating lenses. And I've built these kinds of slides for all of those factors. I'm not going to walk you through them all because that's boring. But just so you know, this is kind of where this next piece is coming from. And so here are the insights that I derived from those correlating factors. The first is that women take 25% longer to come to Siloam than men. This means they've gone to a different shelter and then come here. This stat is only looking at women who did start in a different shelter and came to Siloam. If they came to Siloam first, they're excluded from this. Similarly, Indigenous folks take 26% longer to come to Siloam than non-Indigenous. Then we have something I'm calling the 1-year phenomenon, and I talked to Grant and Chris about this, and I want you to reach out to me if you can explain this. But essentially, the 1-year phenomenon is that a disproportionate number of folks move from other shelters to Siloam after being in those shelters for nearly a year. It is very much non-random, and as to the best of my knowledge, I have not there's no 1-year policy at any local shelter that should impact this. So it's not like after 1 year people have to leave. None of the shelters around here have that policy. So this is the 1-year phenomenon. Basically along the x-axis here, 10 and the numbers on the bottom represent how many days between they arrived at a different shelter and came to Siloam. So 1 to 10 is represented by 10, 11 to 20 by the number 20. So you can see that 42 people came to Siloam within that first 10 days after having stayed at a different shelter. And then from there on, it gets really random. It's basically just up and down like you would expect. But then at 351 to 370, we see 2 massive spikes. And I don't have a clear explanation for why this is the case, but based on this, it looks very non-random to me. And so this is like a 1-year seasonal, I'm questioning whether it's trauma related, who knows what experience that folks have. And I have not seen another shelter that has this kind of understanding, and it might be happening in the reverse. So obviously people leave Siloam to other shelters as well, and I'm not tracking that the same way. Back to my key insights, younger demographics use the shelter for less time. The older non-Indigenous population is disproportionately male. We are more likely to house males. Indigenous folks use the shelter more variably, so coming and going. While 36% of, I told you this one already, men who use Siloam shelter are Indigenous, 66% of women who do are Indigenous. And then we see an underrepresentation in Indigenous folks getting housed. So it's about a 2x factor, Indigenous to non-Indigenous. Key insights number 2, newcomers in this recent wave are younger than the average. For our shelter, we're all male, stayed only once, and we're much more likely to be housed. They were by far the highest demographic in terms of being housed. 13% of those who use the shelter are known to be housed. That's way too low. I'm going to talk in a second about closing that data loop. Someone arriving at Siloam as their first shelter is 4 times more likely to be housed by Siloam than someone who used another shelter first. Now, this isn't saying they don't get housed, because we don't have the data on whether they got housed by another shelter. We'd have to find it in HIFIS, but that's just a lot of looking. Indigenous folks use the shelter twice as variably as non-Indigenous. Women are 50% more variable in shelter use than men. Older folks use the shelter longer, with the 70+ cohort using it 4 times as long as the 18 to 29. Non-Indigenous folks use the shelter 21% longer than Indigenous, and males use the shelter 41% longer than females. These are just some of the things I pulled out. I have a 36-page report that I sent to Grant and Chris last night that goes through a lot more than that and looks at the actual numbers of what people are experiencing and how the different groups are sort of navigating their way through Siloam. Now, all of that is great, but the question becomes, how do we operationalize that? What are we using that data for? And this is what Chris was getting at as well. So on the macro level, one of the key things is recognizing trends. Last year, September 2023, we started to see more refugees starting to use our shelter. And so we kind of jumped on that, started really closely tracking, asking questions, what was going on. It had to do with the change in the laws and how Canada was being treated as a third country. And so it meant that we were able to then advocate at the government level to say, hey, something's going on here. We need more shelters. Other shelters in the area, like the Salvation Army, were noticing the same trend, and we were sharing data back and forth. And so that was really, really helpful. Another one that we noticed is that we have what I call a shelter within a shelter. So while we have 143 beds, and from the outside, all the 143 beds look the same and operate the same, they are not being used the same. What that means is we see that we have like a shelter within a shelter, and that's about 40 to 50 beds that are being used by those chronic shelter users that are just simply not leaving those beds, and they continue to hold on to them. And so effectively it's become kind of crappy, permanent, supportive, free housing. And that group, like I said before, is majorly disproportionately male and older. But that's that shelter within a shelter. So then on the micro level, one of the things we have included now is what we call resources. So we created a resource package on how to get to helping with housing, income, and identification. And it's just 3 pieces of paper. And on the top of them is also a QR code. And that links to a website that has the same resources on it, except there, all the links are clickable. So people can use the QR code. And we also made it be the landing page of our computers that folks can access. So on Google Chrome, when they open it up, that's the first screen they stare at every single time is, do you need help with housing, ID, and income? And then they just click, and then it can go to, we have a giant Excel spreadsheet where one of our admin assistants takes all the apartments that are in the right price range and puts them in there. So folks can look through that entire thing, and she updates that weekly. And so that's the homepage, the resource packet, and the QR code. And that resource packet is dropped on someone's bed if they've stayed 3 consecutive weeks. And we also then follow that up with conversations, which is the next piece. And if they don't leave or they don't find housing, they'll get that resource package around 5 to 6 weeks later again, and in perpetuity. So that'll keep coming back, and their name will keep surfacing on the list. We had one time when we started that about a month and a half into doing this, that we actually had one of the shelter users who'd been for multiple years, came down to our transition services department and said, I thought I was going to die here, but something about seeing this got me thinking about housing, and I want your help. And they had him housed within about a month and a half. And so just that action of seeing the resources was enough to get him jumped on moving out. The conversations piece. So this one is the one that has been really exciting and really fun to watch evolve. We've changed the way we do it about 4 or 5 times in only a year and a half. But we have 2 housing-focused caseworkers. Their job is explicitly to move people from the shelter into housing. In an ideal world, I think we could use about 7 or 8, but we have 2. And every week I send them a list of names it's a mix of people who are brand new to the shelter, who've been in the shelter for the medium time, and who've been in the shelter for the long time. And it's a list of 20 names each week for those 2 staff, so 40 names in total. And their job is to go find those people and talk to them. And that conversation can literally be, hey, my name is Paul. Do you want help with getting housing? And they respond to telling you to get F off. And you're like, all right, I'm marking it down. I had the conversation, right? I started it. And when they write it down, they put the date in, and then that name will rotate back up to the top of the list somewhere around 6 to 8 weeks from now, depending on the situation and how things are going. And so the goal there is to ensure that no one gets missed. The goal there is to ensure that we talk to people early in their arrival at the shelter, and then just to figure out who wants to get housed. So that is kind of how the housing-focused caseworkers put their feelers out. It doesn't make sense for them to just always go to the same people who are like, I'm going to die here, which some people say, and try to get them housed. They go back and have those conversations saying, are you interested now? And the answer is no. They back off. But when it's hey, that person jumps at it really, really quickly, they'll move on there. And what we find is as we're moving more people out on the shorter to medium end of the spectrum, those who are chronic are starting to notice, right? And as soon as we move a few chronic people out, they start to notice, the others start to notice, hey, my friend left, and I'm interested now. So that's a really important piece, and it's been really exciting to see. And I have no doubt that that's had a pretty big impact on how many people we've been able to house. Right now, though, there is a mismatch between goal and reality, and that is there's a time delay. There's only a few staff. They can't always find people. But even with that, it's already impactful. And so as we've been working on this process with simply just a spreadsheet and some formulas, and I will say, because I got to say it somewhere, I do not know how to write formulas, and I don't know how to use Excel. I have written all my formulas exclusively with ChatGPT. I tell it exactly what I want from what cells, and it puts them out a formula. I put it in, I test it, see if it's doing the thing I want, and then I go back and say, it didn't do this, it did this, and then it reiterates and gives me a new formula. And I will say that after 22 months, I have learned how to write some of the formulas myself, because one of the things it does is it creates the formula and it explains the formula to you. It'll explain what each piece of the formula means and what it's doing. And so I've started to learn how to use those formulas. And for some things, I don't go to ChatGPT anymore. I know how to write it myself. But don't be scared about formulas. I'm convinced that a massive improvement on what we're doing could be accomplished with about 4 staff hours per day. So I put in about 1 hour a week. But if I had had the foresight or the whatever it is, I would have wanted to advocate for staff time, whether it's mine or otherwise, to do about 4 hours a day of work of bringing information into the spreadsheet, creating lists of names, distributing those to staff, and saying, when you talk to that staff about housing, just send me an email. I don't want 70 people accessing my spreadsheet. It would just get too messy, but just sending the emails back and forth, right? And then me updating the spreadsheet. I think we could do that on about 4 hours a day, and it would massively change the housing conversations and the housing outcomes. The reason I have not done that is because throughout this entire process, we have been building a data system that we are excited to work on that will do this for us. And it will not require any of my staff time, and it will be available to all direct service staff to have the information they need when they need it. But even without that, I think that someone with just a spreadsheet and a few ChatGPT formulas and a bit of staff time we could improve our housing rate right now 2 to 3 times without a change to the system, just more dedicated staff time and focus. So the outcomes here is about 150 people housed from shelter in 20 months. So that's just over a capacity of the shelter that we've housed in 20 months. Obviously, there's people who have been there that entire time and have not left, but we've housed the equivalent of the entire capacity of the shelter. And of those 150, 19 have returned. So now as an organization, we are housing someone around every 2 days on average. That doesn't make sense on the math because the 150 is people housed from the shelter, and the people that we house as an organization include people who are living on the street or in other shelters. But as an organization, it's on 2-day average this year. This helps us drive housing decisions as well. So when I look at this, the spreadsheet, one of the things we noticed, like I said, was 8% of shelter users are chronic, but they use 40 to 45% of the beds. Most of them are senior males. So one of the things we want to do is make sure that we open up housing for seniors and getting them housed if they want to get housed together as much as possible. We'll open up beds for significantly more folks that will move quickly through the shelter. So if we took those 45 chronic people, we'd open up 45 beds. The average length of time someone uses our shelter is 21 days. That's the median, not the mean. But the median is 21 days, which means every bed we free up from those 45, we could put 17 people per year. So that's 765 additional people could have emergency short-term housing and not be sleeping outside just by housing 45 individuals. It should also be noted that group of 45 has lower variability and longer stays, meaning we know where they are. We don't have to go, it's not hard to find them. They're here every night over and over and over. So there's a consistent presence that we can use to build relationship and casework. Last slide. Next steps for us include like I said, a new data system. I am not planning for this to be an advertisement for that data system because we're not even using it yet and we don't know how well it's going to work. But the idea behind it is it will be in real time. meaning that one person enters data and someone else can action it right away. It will only present names that are in the building. So staff won't have to run around trying to find someone who leaves every day. And so when that 20 name list that I generate for the housing focused caseworkers goes out, probably 7 of those 20 are in the building on any given day. So they're looking around for someone and it takes a long time. That list would only actually propagate names for people who have checked into the drop-in. We would expect the data system to have at least 10 times more data points than any other HMIS currently in use, except the drop-in in Calgary. Have to give them a shout out. And we would still have all the cluster benefits if other organizations join. So we are working in partnership with Main Street Project, which is another one of the large shelters here in Winnipeg. It would have user level position or permissions, meaning you can set to the specific person what they are allowed to do or see or not do or see. And it has real-time notifications and alerts. This means, for instance, if we've received someone's ID card in the mail and we know that it's there, it's with their caseworker, the caseworker can put a flag on that person's name. And if they show up at any service that's connected to the software, as soon as they show up and check in, that caseworker gets an alert on their computer that that person is checked into the service. And whether that's in our building or a different building, they can make sure that they know that that ID is available for them. I do have long-term goals. I'm not going to touch on this very much, but basically my hope is that we will create 4 different levels of surveys at different times of someone's experience. So a small, short demographic survey at sign up, and then the diversion survey at shelter sign up. So sign up being in the drop-in, shelter signups being when they apply for or want a bed, which we see that about a 10-to-1 ratio. We're a bit of a weird shelter that way. We have 10 times more people accessing our drop-in than we have staying in our shelter. That's partially because our shelter has a capacity and we don't go really beyond that. But that diversion one would happen when they sign up. Then after 1 week in shelter, I'd like to do a barriers and needs assessment, and I'm borrowing heavily from the drop-ins work in Calgary for that. And then after 1 month in shelter, build a housing survey. We have already built the housing survey. We're rolling it out with focus groups this month to try to understand what we want to do in our own housing strategy. But we basically want to use the demographic diversion, barriers and needs assessment to determine what steps are needed for this person's casework or for their housing journey. And each of those would have altogether, they'll probably have about 100 data points. Like, do you have ID? Do you have this? Do you have that? What's the barrier? And so the staff will know. And my dream, and this is a long-term dream, is that we'd actually be able to really understand through the data, what are the barriers and what are the key interventions. So at any point in anybody's journey, a staff would actually be able to pop up their profile when they sign in, and it would show there, the next intervention this person needs is making a phone call to look for an apartment, or getting them ID, or setting them up with a caseworker, or whatever it is. And it's like, oh, I can do that for you. And they know immediately. Every staff who ever accesses the system knows immediately what the next thing on that person's journey needs to be. And that's a big goal, but that's one of my goals for it. So to just drive decisions for next steps on a per member basis. And then also in the back end, be able to understand who is becoming chronic, and then be able to intervene early on that journey. And we use it also now. We're going to start using it to prioritize what types of housing to build or create. Right now, Winnipeg is in a housing crisis, and you could throw anything at the wall and it'll get filled. But if we actually make any significant steps towards solving our social housing crisis, we'll need to get more specific as time goes on. And so we want to understand what needs to be built. That's a piece of it, and that's what that housing survey will do. For the 10%, it's a 10% of those who sign up for drop-in use shelter. 1/3 are gone in a week, 1/3 more are gone in a month, 1/3 more almost are gone in 6 months. So past that 1 month, we're looking at the last third to 40% of folks, and we'd ask them about what type of housing they want, because we expect that we might be their landlord. And then if we're working with casework, we also know what type of housing they want. So as something opens up, the other ability that we hope to have is to shortlist people with specific needs when housing becomes available. So if people tell us, I want X, Y, and Z in my housing, and we've got a list, and when that housing becomes available, we just filter by all those factors, and we get a list of 12 names of people currently in the shelter who said they wanted that kind of housing, and we can start right there. So that's the long-term vision of that software and what all those surveys will accomplish. So I've been talking for half an hour. And I think that's roughly my time. But it's quite a journey. A lot has changed in the last 3 years, and it's been really exciting to be a part of.
Thank you so much, Paul. And your presentation did generate some questions that we were able to kind of answer as you were speaking, but there's some open ones still. I will kind of highlight for me as you were talking too, is like, um, often we hear that shelter staff are saying like we're incredibly busy or our shelter's incredibly big and there's just so many people, the volume is overwhelming. And so what I love about what you just shared a little bit around operationalizing it, your data, was to show like how you can do targeted in reach in your shelter, to say you only have two case managers, they can only support so many people around kind of like what next steps to assist with the rehousing process. Here's a list of names based on some that we got from the data around who we want you to target to help with taking those next steps with, and then generating new names after that, right? So that's really, really cool.
Yeah, we had about a year ago where a situation opened up where the women's shelter had not seen any turnover in a while. So just we spent like the next month basically saying, I'm only going to put female names on the list. Like you're just the only people we're going after right now is females. And that made an impact. And we opened up beds again.
Hmm.
I
And
think if I can grant like just the beauty of the clarity, like some of that data that you shared counteracts most people's impression of homelessness and who is in shelter. So like being able to like truly demonstrate that like people do move on. The vast majority of them move on, and people are their experience of homelessness is rather short. So
Mhm.
that's mostly who you're seeing, and being able to back that up reframes that this is a solvable thing for lots and lots of people. I also think you're probably being harder on yourself than others. I think your 1 year phenomenon may be explained away by the fact that like if you're housing 150 people a year, which is 4 times higher than other shelters may be seeing, I think people just may pick up on that and want to come to the
I
place
would
where
love it.
solutions.
Yeah, I would love it if that was the case. The problem is I've tracked that group and unfortunately not a single one of them have been housed. So I'm like, like that it's interesting. Like maybe they are showing up for that reason. But part of that is they are just variable movers between shelters in general, and a
Yeah.
lot of them are not in our shelter anymore. So like they came, they
Mhm.
left, and they're gone. So like whatever they were at other shelters for, they might have gone back to being at those shelters. So it's just I don't know why it's a year.
Yeah.
Mhm.
It's it I love it because it just creates a sense of curiosity, like what is happening?
Yeah.
Yeah, Paul and I had that conversation. Like, it's not linked to length of stay, like that's like determined by a fixed end date at shelter. There's nothing consistent when it comes like time of year or weather or anything like that. It's definitely a head scratcher right now. So I love that idea too of Paul, you just putting it out there to attendees, be like, if you're seeing a similar trend and you have an insight about it, like share it, right? We do have one question from an attendee that's still open that says it's kind of a question for all, but maybe you can direct this to Paul because it is a little bit about gathering data in the shelter. Is like any suggestions, ideas, thoughts for a small shelter just starting out on the journey of gathering data? Max capacity in their shelter is 8, and different staff working on different nights mean that we aren't always able to know who is a new guest or if they always also stayed the previous night. Some folks are friendly and willing to share their name, gender identity, and much of their story, but others don't want to share much at all, and some are intoxicated or otherwise unable to share or consent to sharing information. If these folks only stay one night or a few nights, we may not gather any data from them and don't want to create a barrier for folks who need a warm place to sleep but don't want to share their personal info. So thoughts around that, Paul?
Yeah, I think the first thing is folks obviously can deny sharing any data with you at all, and we get that all the time. And in the new data system, we're building in both just an anonymous profile, but also one of the other things that we're doing, and we do this now already, is people can refer to themselves in whatever name they want. And so if they want to be Donald Duck in the software, they're Donald Duck. That does get a little complicated if they have, multiple aliases that they might go by. But we have a consent form. They fill that out. We find well over 95% of people don't have an issue with it when we explain to them what the point is, to understand that this is to help you on your housing journey, and to make sure that we can get you housed as quickly as possible. With 8 people or capacity of 8, like you could build a spreadsheet and that spreadsheet will like serve you well enough for so long. I feel like, and one of the things I offered to Grant and Chris and can throw it out here as well is that if people want to like walk through what our spreadsheet looks like, I'm willing to build one that has no, personal identifying information in it, and just walk people through that and show them what that looks like virtually, including some of the formulas and metrics and whatnot. Our spreadsheet is kind of ballooned because the original idea and how I used it has shifted a little bit over time. So there's some legacy stuff in there that is not actually being used, but I don't want to delete the columns because there still is data in those columns, but we're just not taking those columns into account anymore. So
Great.
it's a pretty excessive spreadsheet.
Well, and I think the point that you made too, and I kind of echoed this when we talk about coordinated access, is that we will see, it's obviously voluntary to provide information, but we will see people, the refusal rate go down significantly when we actually take the time to not just ask personal questions, but exactly that, explain how this information directly links to how it can help them in the rehousing process, match them to housing that's appropriate or to the right supports that will help them, or might even help them with being prioritized for specific things, right? So, yeah.
I would add in, like, for anybody that's been on the fun journey of transitioning from the older version of HIFIS 3.8 to, the shared version of HIFIS that most folks are using now. There was a lot of worrying before that of like, well, what's going to happen if this? What's going to happen if this? So like focusing on all the potential negatives, and in reality, once we made the switch, things like most of those didn't materialize. So I do like, just like Grant Grant and Paul said, like, I think if you can explain why you're tracking things, most people, not all, most people will be okay with that, because I think we're also working in a sector now where people expect us to do more with their data than we had previously. So uh, it's better to ask and be told no than to assume a no and not ask.
Mhm. Well, and I think Elle's question also gets into a question that I wanted to ask too, was to say shelters operate on 24-hour schedules, typically with staff working shifts at different times. So, like, how do you ensure, like, what are some practices to consider to ensure, like, your data quality and how it's being gathered is consistent across staff from multiple programs within your shelter or that work different shifts? So, for instance, your outreach staff are collecting data in a similar quality as case management or your floor shelter workers or your housing navigators, things like that.
Yeah. So I want to get to one thing first, which is the different shifts. I'll talk about that first. So we're running a overnight warming space through December through March. Capacity of 116, 2 different groups of staff that are rotating back and forth. So they obviously have that as well, who's new and who's not, right? And I, because it's just the simplest way been doing it, have again built a spreadsheet because that's what I become known for, where it's just first name, last name, and then did they show up on this night or did they show up on the night? Like, and every part of the challenge here, and it's not a lot of work, and I'm just doing it myself because I felt like it was easier to do than to try to teach someone to do this. Is every morning I just look through the spreadsheet, and essentially what I do is I filter the column for last night by who attended last night. And then I filter the column. I have a column where that just adds up a formula of how many nights has this person been in the overnight warming space. And I filter only the people who have a number 1. So they've been here last night and they have a number 1, which means last night was the first night I entered them in, someone entered them in the spreadsheet. Out of 120 names, that gets me about 20 names. Out of 120 names from last night, out of 1,000 names in the spreadsheet, that gets me 20 names. I then just simply highlight those squares, color them red, take off all the filters, sort the list alphabetically by first name, look for the red squares, see if there's another name that's almost identical to it, and if it is, merge the two, keep going down. And then I sort by last name and do the same thing in case they've screwed up spelling the first name. And then I just go through. And by doing this, I think I'm confident it's less than 2% duplicates, probably less than 1% duplicates. There's still some, but so that's kind of just like in terms of the shift thing, and that takes me 10 minutes. I just put a podcast in, look for names that are the same, and I'm only looking at 20 names every time, so it's not like I'm looking through 1,000 names. And you could do that. You don't have to do it every day. You could do it. There'd be a way to do it on Monday for the weekend. I think it gets more complicated then because a mistake is more likely to propagate in multiple days, right? And then it just gets more complicated. So if you can catch the mistake on that first day. The other aspect is, to answer your question, Grant, or to try to answer it, is training. Training over and over, time set aside in their day where they know they actually have. Like last year, we had an overnight warming space, and the biggest issue was we didn't have enough staff. So we got terrible data. This year, we have enough staff. So there's one person who's sitting at the computer all night, and they might rotate who that is, but there's just the actual time to take in names when people are coming in. And then about a month into using it, I sent them a report just saying, here's how many names are in the spreadsheet. These are people whose lives you've directly intervened in and possibly saved from freezing when it's minus 30 outside. And out of curiosity, just so you know, about 45% of the people who used the overnight warming space have used it only once. So it's not, again, just like the shelter, it's not that everyone is coming every night over and over and over, even though those are the people you remember. It's actually a much broader user base, and it's intervening in emergencies. So for those folks, this was probably a life-saving critical thing that you did, and basically immediately show that data, and they know that it's relevant.
And I think
Yeah.
that email, that sharing of the data is probably the most important possible thing that you can do. Because you're mitigating burnout by folks not feeling like they're doing the same thing every day for the same people and not seeing results. So like you're proving that their work matters.
That's my hope. Yeah.
Well, yeah, and you're building in, and it doesn't have to be super formal in like a monthly report or an AGM or whatever. Like you're just taking a moment to shoot an email to a team to say like, hey, I've seen I've seen the improvement in your reporting and your tracking, and I just want to share back to you like the direct result of that and the impact that it had on people that you're helping. That's tremendous. Um, I want to ask one more question and then we'll have to kind of wrap up. And maybe you can do it in like 60 seconds or less, Paul. Is we hear a lot from people around saying like, seems to be a lot around funders and funding requirements for a lot of these legacy data things or like a lot of output driven kind of stuff like how busy you are. So how do you collaborate and like have a conversation with different levels of government that are funders or, not government that are funders around helping them make that shift to some of these data pieces that you mentioned as opposed to the legacy ones?
Well, I mean, you said 60 seconds. Have you met me, Grant? So the challenge there is we did this with our provincial government. Those housing focused caseworkers are provincially funded, and they had a giant thing, and we're still reporting this way. But we said, this is the stupidest stuff you're tracking. Like, this doesn't make any sense. Why are we doing this? It's a waste of our time. And they're like, okay, we'll just keep doing it until we solve the problem. And the person that was in charge of it left, so that's unfortunate. But what they've done now is because of that advocacy, is they know that there's different metrics. We've told them here are the metrics we want to report to you, and they actually stole our CEO. So they're like, hey, we need to help solve this problem, and they took Tessa from us. And so as with her going over, she understands the metrics. So that was advocacy gone wrong in that we lost our CEO. So if you push too hard, you might lose the data champion. No, I'm just kidding. But we're really hoping that makes a difference as well. So that's been a tough part of the conversation, and we're still in that feedback loop of how do we improve the metrics.
Well, that's good too to talk about too, like even as service providers to funders, it's what gets collected as data for reporting is not a one-way street, a top-down. As a former funder, I would try to be open to the folks that we fund to say like, if there's key metrics that we're not asking you for that you think are really valuable for like reporting on these types of outcomes, like let's hear it, because otherwise, yeah, it has to be kind of that two-way street vibe.
And
Okay.
even
No, I don't know if I can't speak for the whole country, but in Manitoba, it feels like there has been a vibe shift away from just the fluff numbers to let's actually talk about what's working.
yeah,
Mhm.
I think if you think of like the reality of what shelters have the capacity to do, like of course we can't put the entire weight of solving homelessness on shelters, but what shelters can do better than most other programming is strategic work to reduce barriers. So, how are you measuring the work that you're doing with individuals that come and access your services to reduce their barriers to housing? And how do you demonstrate that to your funders? Like that's the core of what you're doing is getting people set up for housing, not feel like you're responsible for all of it, but that's the piece that if you can measure that, improve that, great.
Mhm. So we are at the time. I'm gonna do one more thing. There's lots of questions I can see that people will have. Paul and Chris have already shared to say yes. Like if you have questions and you want them hopefully answered by Paul or Chris, like email me directly at grant@transformshelter.ca. Happy to kind of like make that connection and get your questions answered if there's follow-up meetings and things like that that are needed. But I do want to just share real quick. If you have your phones out, please take a picture of the QR code. It will bring you to a link to really help inform our webinars for the year to come. It's really, really valuable for me to know as we're setting the agenda for the year that it's topics that I feel of greatest importance to you and relevant to you at your shelter. And you can write in any additional ideas of topics that are already captured. If you didn't have the chance to pull out your camera and scan this QR code before I move to the next slide, you can always email me directly and I can send you the link. The other thing that I will share too, that I'll make sure I'll put the link in the follow-up email with all the slides and everything that was shared today, is King's University College researchers are wanting to hear from people working in the homelessness and health sector to really kind of understand how, like, sorry. It's to really kind of understand your needs as people working in this sector, working with people who are impacted by their health and homelessness. It is a survey that's about 15 to 20 minutes, that's completed online. It's voluntary, but it helps inform, hopefully, practice, education, and policy. And at the end of the survey, you can provide an email to enter a draw to win one of 10 $100 PC gift cards. Your email cannot be linked to your survey responses, which will be completely anonymous. So if you're interested in participating in that, they really would love to get direct feedback from people working in the sector about the needs of people working in the sector. Um, Before I say my thank yous and my goodbyes, I want to also just give a quick acknowledgement that I just noticed in the list of attendees is my sister Andrea. So that's super cool to see her, like just like a sibling supporting another sibling. Um, what a great
Andrea,
sister.
I have so much to share about what Grant said about you.
All good things, all good things. So I just want to give a big thank you to Paul and to Chris. This has been an amazing webinar, way to take a subject like data and engage an audience in something that's really, really important. And I want to thank everybody for their attendance today, their participation, their questions, their contributions to the chat. And as always, as I've already said, reach out. This is just the start of a conversation about data. If you want to figure out, like, get into the weeds around how to operationalize the stuff that Chris and Paul talked about, or even like this spreadsheet idea is scary, but I need someone to hold my hand around its inception and rolling it out, reach out to me and we can have conversations with Paul about how we can help your shelter start that journey. So with that, thank you, folks. And I hope everybody has a wonderful remaining Wednesday, and we'll see you uh, in February for the Motivational Interviewing and Assertive Engagement webinar. All the best.
Thank you so much.
Grant,